We need to get to a single best chart. Here's Brendan Greeley.
Aetna is acquiring Humana. That is a $35 billion deal. Anthem and Cigna may be next. What is driving this M&A? That is the subject of our single best chart. Tom, we are looking at growth in healthcare costs. So this is not premium growth. This is the underlying costs. And what's happening is you're seeing a chain reaction. There has been, since the Affordable Care Act passed, $50 billion in mergers in primary care providers, so hospitals. And what we're seeing right now is insurers are trying to keep up. That growth, there was a brief dip because of the recession. You see that spike there in 2014 right after the marketplaces kicked in. The long-term trend, however, is going to continue to climb. People are getting older. More people are acquiring insurance. There's a lot more money in that pool.
And it's way above inflation. I mean, the real growth within the sector is breathtaking. What does that say about the Affordable Care Act?
Well, it seems like there are two problems to fix in health care. One of them is making sure that people are covered. The other one is dealing with runaway costs. So we have addressed one. There is a lot more to do to address the second, which is runaway costs. There were some experiments in the Affordable Care Act. Some of them have borne fruit, changing the way people provide coverage. We really haven't addressed this huge problem. As I think everybody at the table knows, our healthcare spending per capita is beyond all proportion of any other country.
Spending is slowing, though.
Spending is slowing.
I mean, the growth of spending is slowing. The growth
of spending is slowly slowing. But as you see in that chart, long term, again, people are getting older. Those costs are rising. And so one of the things that we'll be looking for is, as, we do not have a single-payer system, but, as we see these consolidations, how much will justice allow these mergers to go on? We have the top four now considering deals with each other.